Kim Lee. I'm at Bucks County Community College, and I'm doing health assessment course with Christopher Smallwood. When I first come in, I would make sure I introduce myself, wash my hands, check her ID badge, make sure this is the patient, ask what their concerns are for today, what brings them here, ask them, find out about their history, their health history, do a physical assessment, and obtain any labs or any orders that the physician might order for them. Upon my assessment, I'll go through a smoking, alcohol questions with them. When was their last BM? When was the last time they voided? Are they having any difficulty with their urination or their bowel movements? Are they experiencing any shortness of breath? What are their religious beliefs? And are they having any pain? What the scale of the pain is from 0 to 10? And have they had any pain medication prior to coming in, and what medications they had prior to coming in. Upon that, I would start my physical assessment. I would begin by looking at their scalp, palpating, looking for any obvious bumps, bruises, tenderness, checking their hair for lice or any kind of bugs or anything like that. Upon that, I'll go around and press and palpate along their sinuses, see if there's any tenderness noted, observe their nasal passages, check to make sure there's clear patency in both nostrils, check their eyes, see if there's any discoloration with their sclera. Is it yellow, brown, spotted? Is it red? Is their pupils dilated? Are they reacting equally? Is their symmetry good? After that, I would check their ears, see if there's any soreness when I palpate their ears. Is there any breakdown behind their ears with their skin? Are they having any whistling in the ears, any ringing in the ears? After that, I would go to the mouth. I would check, is the mouth moist? Is it dry? Are there teeth there? Is there any lesions I'm inspecting under the tongue or in between the gum and the teeth? Are they having any pain when they're eating? Is their tongue having any kind of color on top of it? And I would also check their palate. After that, I will go down towards the neck, check the lymph nodes, check the jugular, take a pulse, go along the shoulder, the clavicle, feel any tenderness, feel for any lumps, any lymph nodes. Go along with the range of motion in their arms, check their skin. Is their skin color? Is there any lesions on their skin? Check their pulse. After that, I would check both sides. And then leave their privates covered, and one area at a time, check their breasts. See if there's any visual signs of anything protruding, any lumps, any irritation. Is there any discharge at the nipple site? I would do that for both sides. I would check their bowel sounds. I would auscultate all 4 quadrants, see if there's any peristalsis, see if there's absence of bowel sounds, if they're hyperactive, tenderness when I'm palpating, listen to her heart. Make sure that there is no listen to their heart. Upon that, I will go and check their inguinal area, check for any hernias, check for the femoral artery, check their genitalia area, make sure there's no swelling, any discharge, any lesions. Ask them if they've had any sexually transmitted diseases, which I should have asked before. When I am doing this, I would be wearing gloves. I would then go to the lower extremities, check the popliteal pulse, the femoral, up here, the tibular, and the pedal pulse. Oh. Upon that, I'm going to inspect all their toes. I'm going to look for any signs of any ulcers, venous, arterial. Is their heels boggy? Is there any breakdown? Are they a diabetic? Check for the, what else am I checking for? Oh, and along with this, I'm checking their skin. I'm also checking to make sure that there's no breakdown on their bottom. I'm checking for any curvatures of the spine. think that's it. Yeah, that's it. Along with that, I was asking their neurological state. I would ask for their, you know, what their year is, what year we're in, their name, do they know where they are, stuff like that. So